And welcome to the Dr. Bob Show. You know, you and I only have two eyes. What are we doing to protect those eyes? Do you know that there are things we can do at a young age and as we get older to prevent having difficulty with our eyesight, leading to blindness? We'll be spending most of this show talking about what we can do to protect our eyes so that we won't have visual problems later on as we mature or even at an earlier age. My guest is Dr. Darin Smith. He's a board-certified ophthalmologist. He answers these questions every day and has great information for you and me. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about why do I get dizzy when I stand up, and I've got high blood pressure and my doctor says I need a sleep study. Was he really awake? Is he crazy? Do I need a sleep study if I've got high blood pressure? A lot of information for you. You'll want to stay tuned. We're talking with Dr. Darin Smith, board-certified ophthalmologist, and we're talking about how to prevent having eye problems later on. Darin, welcome to the Dr. Bob Show.
Great to be here, Bob. Thank you.
Darin, how many eyes do I have?
I think there's two.
Okay, so I've got two eyes now. Are there things that we can do to prevent my vision from not being going downhill later on?
Oh, it's like a lot of things. Prevention is really the key to keep from having troubles in the future.
A stitch in time saves nine. What age can we start preventing eye problems?
Well, you know, even at little babies. So babies and young children, even before they get to school age, you know, I would probably recommend being seen by someone who specializes in seeing children. You know, early signs of lazy eye can cause lifelong problems, but it can actually be found early and treated very successfully.
So an eye exam early is a good idea because the doctor can see if you have a lazy eye. Anything else he's looking for to prevent vision problems later on?
You know, if the child, if a baby is really having problems, a lot of times the parents are going to pick up on that. But subtle things can still happen. Even in today, with all the technology we have, people still end up with what's called amblyopia, which is just where the brain never learns to develop good 20/20 vision. And that can be prevented a lot of times.
How about the young child that's in school? Let's talk about first grade, second grade. And they're sitting on the front row and they're squinting their eyes because what's going on there and what do we need to do if somebody's having eye problems?
Usually they just need glasses. A lot of times it's, you know, kids, a little nearsightedness or a little farsightedness. But basically it's just a general eye exam to see if there's a need for some glasses.
When you do an eye exam to see if they need glasses, is there anything while you're screening that you look for at that time?
Well, sure. I mean, you're doing a complete eye exam to make sure that there's nothing going on, you know, with glaucoma or cataracts or any other kind of problems that can happen basically at any age.
So an eye exam at an early age, you recommend the eye exam at an early age. If somebody starts, their arm needs to get longer, what's going on there?
So usually what you're talking about, the medical term for that is presbyopia, which
presbyopia. Presby means old.
That's right. It's one of the most common things in the world, but no one knows the word. But basically what happens is sometime usually in our 40s, the lens inside of the eye starts to lose its ability to find focus for up close. And so when that happens, the arms keep going out. And in lieu of getting an arm transplant for a longer arm, we just get reading glasses.
Okay, and the reading glasses will make it where you can read. How about looking far out, nearsightedness?
Yeah, I mean, again, nearsightedness, that can happen at any age, and usually that can, you know, really help with seeing things in the distance.
To prevent eye problems later on, vision problems later on, let's talk about cigarette smoking, son. Tell me about cigarette smoking. What can it do to damage vision to cause blindness later on?
Yeah, so the main things I see with cigarette smoking are cataracts at a younger age. What a cataract is just where the natural lens in the eye can get cloudy. Oftentimes that's related to age as we get older. That's very common. But people who smoke can get cataracts much worse and at a much earlier age.
And we'll come back to cataracts. The main vision symptoms you get with cataracts are what?
Blurry vision.
Blurred vision. Okay. Now, the other thing cigarette smoking can do?
Macular degeneration.
Macular degeneration.
Yes, sir.
I thought that was always age-related, so it can be tobacco-related.
Well, macular degeneration, one of the risk factors can be cigarette smoking.
What does that do?
So the macular degeneration is just a weakening in the retina. Okay, so the bullseye of the retina for vision is called the macula. It's the center of the retina. And so the macula just becomes weak. As it becomes weak and worn out, if you will, the vision goes down. At the end stage, macular degeneration can cause severe disability with a blind spot right in the area of central vision.
So if somebody's a smoker, they can get macular degeneration and cataracts. So how do we tell people to stop smoking?
Well, you know, if I see someone who has these problems or who is a smoker, you know, I do recommend stopping. You know, sometimes people, they don't want to stop. You know, the fear of a heart attack or whatever isn't enough to get them to stop, but sometimes the fear of going blind is. And so it's just one more reason in the line of a long lot of reasons not to smoke.
How about eye injuries to young children? To me, as you grow up, you're lucky if your child doesn't get a bow and arrow or a rock in the eye or a finger or basketball or football. How about eye trauma? Anything we can do except
Well, you know, eye trauma, especially with sports, is very common. So, you know, using whatever, depending on the sport that you're playing, you know, use the recommended, you know, eye protection. You know, racquetball would be a great example of you know, the very high need for wearing goggles when you're playing.
Why with racquetball? You got a ball that's going at a high speed.
High speed, and then the ball is small enough that it kind of fits in the socket of your eye.
So what does it do if it hits the eye and its socket full? Bingo, blows out things?
Yeah, it can, you know, blunt trauma can be devastating to the vision, can cause blindness. Obviously, any kind of sharp trauma, you know, that would actually lacerate the eye, that can also be very devastating.
I see basketball players, professional basketball players, and they've got the Phantom of the Opera mask on one side. They've got something that are big eyeglasses or big something. What happens if it's a scratched eye with a fingernail or what?
Yeah.
Talk to me about that.
So you know, more mild traumas, a little scratch on the cornea, can be exquisitely painful. It causes a lot of tearing, a lot of severe light sensitivity. Fortunately, corneal abrasions or corneal scratch can heal up pretty quickly within a day or two.
If you don't take care of them and they don't heal quickly, can you get infection and that damage the eyesight and lead to blindness?
Oh, absolutely.
So it's serious.
Oh, it potentially could be very serious.
And I'm amazed at how fast the eye heals. It's just absolutely amazing. But you have to pay attention. So if it's not healing, if a corneal abrasion, a scratch, should heal in a couple of days. If it doesn't, what are the signs and symptoms?
Oh, increasing pain, increasing redness, decreased vision.
Goop?
Mucus, pus, you know, any of that kind of stuff. I mean, you really want to see your eye care professional.
So we've got a lot of things at a younger age. When somebody is 40, 45, 50, we start looking for other problems, but we can look at it at an earlier age too. So I'm thinking as I'm talking, diabetes, glaucoma, cataracts, and age-related macular degeneration. So let's pick 2 or 3 minutes worth and tell me about glaucoma. Okay. What is glaucoma?
So glaucoma is a disease where pressure inside of the eye can damage the optic nerve in the back of the eye. And you can imagine a damaged optic nerve is not going to see as good or as well as a healthy optic nerve.
So the optic nerve, the eye nerve, comes from the back of the eye, and there's what do you call it, an optic disc?
Mm-hmm.
Okay.
Yes, sir.
So that disc, if there's pressure on the inside that pushes against it, what do you see?
So as a doctor, what we see is a little what we call cupping on the optic nerve.
What does cupping mean?
If you think of the optic nerve, that disc that you mentioned, it kind of looks like a donut. So the outside part of the donut would be the diameter or the circumference of the optic nerve, and then the hole would be what's called the cup.
Okay. Now, if somebody's got glaucoma, how do you test for that?
Well, glaucoma, it used to be thought many, many years ago that glaucoma was an issue strictly of just pressure, but it's really not. It's an issue surrounding blood flow to the optic nerve. So we have to test the thickness of the nerve layer. We look at what's called the visual field, which is kind of the map of the vision. We look at the thickness of the cornea, the pressure on the eye. So there's a number of measurements we take in order to form a picture.
How do you measure if there is abnormal pressure?
So basically during the eye exam, there's a couple of different ways. We use a little blue light that kind of comes up and gently touches the eye and lets us know what the pressure is.
So that part is easy to do. Then you got to find out what the underlying cause. If somebody has glaucoma, is the treatment good?
Usually with early detection and treatment, people don't go blind from glaucoma, although glaucoma is one of the leading causes of preventable blindness in the world.
And we're going to be talking about other causes of blindness when we come back. So it's the pressure in the eye that pushes the pressure on the optic nerve, makes the blood supply bad, makes the optic nerve where it doesn't work. If it dies, you don't see. So if you catch it earlier, you can fix it where you can see. We're going to come back. We're going to talk about cataracts, what age and what really causes those. Why does the sunlight bother that? So a lot of information for you. You want to stay tuned. We're talking with Dr. Darin Smith, board-certified ophthalmologist, MD eye doctor, and I've been shocked at how many things can cause visual problems as we grow up. Need an examination very early in childhood. You need to look for problems with vision later on. And then we've talked a little bit about cataracts and cigarette smoking, and now we got into glaucoma. I didn't talk enough about glaucoma treatment. If it's early, simple glaucoma with increased pressure, you just let it go?
Definitely not.
Definitely not.
Definitely not. So glaucoma is one of the things that you don't want to blow off. Okay, so at the early signs of glaucoma, one of the problems from a patient's perspective is that there's no symptoms.
Yeah,
so there's no symptoms until later, until it's too late.
So they see good, they feel good, and I don't have to put these eye drops in, but then, so they've got to take their eye drops. What do?
So a lot of times the eye drop regimen can be 1 drop a day. It can be very easy and very tolerable, at the early stages, so shouldn't be too much trouble to do.
Later stages, eye drops not doing it, or they didn't come in soon enough, you have to do some surgery sometimes?
So there's 3 different types of treatment. So there's drops, and so usually we'll do drops until that's not working. There is a laser treatment that can be done for glaucoma, and usually the laser treatment is effective enough to get off a drop or 2. The problem with the laser, sometimes it doesn't last for a real long time, and this is a lifelong disease. It's important to remember it's lifelong, and so once you have it, you have to just stay on top of it and treat it.
Once you have it, you've got it, and you need to respect it every single day.
You do need to respect it.
So there's 2 things. There's the drops and the laser. What's the third?
So there is actual surgery that can be done in an operating room. There's different kinds of things that can be done in order to lower the pressure inside the eye.
Okay, so that's the goal, lowering the pressure and make the circulation of fluid better. Let's get into cataracts. Can cataracts cause visual problems later on?
Oh, I think that's one of the most common things in the world is the formation of cataracts.
So a cataract is in the back of the eye, the front of the eye, or the real front? Where is the cataract?
So what a cataract is, it's the natural lens. Everybody has a lens in the eye. It's that natural lens that has become cloudy.
What's the natural lens that becomes cloudy? So what's the normal lens like? Just clear glass?
So the normal lens is perfectly clear, crystal clear. When we're born, that lens is perfectly clear. And as we get older, what happens, that lens continues to grow throughout life. And so it can't grow bigger, so it starts to grow more dense. Now, of course, the growth of that lens is very slow. But over time, that lens will become more dense, And when it does so, it starts to become a little cloudy. And when it becomes cloudy, we
can't
call it a
see.
cataract.
So how do I know if I've got cataracts just by looking? What kind of visual problem? Cloudy.
So sometimes blurry vision, glare symptoms that's a very common complaint by people. Trouble driving at night, just more troubles with daily activities. This being said, though, a lot of times people aren't necessarily aware that something's going on because it happens so slowly.
That's the importance of a yearly exam on people?
Yes, sir.
If you detect a cataract early, do you need to fix it right then?
No. I follow more cataracts than I do surgery on by far.
So when do you make a decision of when it's surgery? You can't see?
Usually when you can't see, sometimes that decision is very simple. Someone comes in, they see terrible, and that's a really easy decision. Sometimes it's a little more subtle. But oftentimes the cataracts are somehow affecting someone's life. They don't feel comfortable driving at night. They can't see to read. They're having difficulty working. So there's somehow that it's affecting their life.
So the cataract surgery, what do you do to fix that? Because I think this is the marvel of ophthalmology. When you fix it, you have to do what to that old cloudy lens?
So I love cataract surgery. It's amazing. You can change someone's life in less than 10 minutes. So the surgery takes less than 10 minutes for most of the time. And all what we're doing is removing that natural cloudy lens, and we replace that with a clear plastic lens implant.
Now, there's a key issue. You replace it with a clear plastic implant, but you've got so many different ones. Which one do you like best of all for most people? And I know everyone's individualized. But
So there's 3 different types of lens implants. There's what we would consider a standard lens, which is what most people get. Basically, a standard lens will help with distance vision, but that does not do anything for what's called astigmatism, or it doesn't do anything for the up-close vision.
So if you just put in a regular old clear, you're going to have to probably wear glasses in addition, maybe.
Reading glasses at the very least is a guarantee.
So what can you do to be more advanced?
So there is, for some people with what's called astigmatism, which is just a little, a different shape on the cornea that can cause some blurriness. Most people who have astigmatism know what that word is. We can treat astigmatism with an astigmatism treating what's called a toric lens implant. So that can basically give you a little bit better vision than a standard lens. And if you really want to get advanced, there's something called multifocal lenses.
Multifocal. So that means we're going to be able to focus way out yonder and way up
Yes.
front? Tell me about that, because that sounds like that's the ideal.
It's very nice. About 90% of the time, people with multifocal lenses don't need glasses for anything. So it's not 100%. Nothing's perfect, but it can really make a very big difference as far as lifestyle and the enjoyment of vision, distance and up close.
So what does that lens do that lets you see? Is it a bifocal lens replacement?
So these lens implants have little circular rings built into the lens implant. And what's happening is as light goes through the lens implant, those rings are breaking the light up into 2 focal points, one for the distance and one for the up close. And then your brain magically knows which one to be kind of focusing on depending on the task at hand.
I think that's amazing. I used to have a reading contact, and when you looked up here, the left eye looked, and when you looked out there, the right eye looked. Pretty good success rate for lens replacement cataract surgery.
Oh, cataract surgery, I would imagine, has to be one of the most successful surgeries around.
We've got 1 more minute. Tell me about macular degeneration, the difference between dry and wet in 1 minute. You can't do that. And which one's treatable and which one's not?
So dry and wet refers to fluid or blood in the retina, okay? They're both treatable, sort of. All macular degeneration, you need to be on some vitamins. There are vitamins made specifically for macular degeneration. There's a study called the AREDS2, AREDS2 study. So you need to be on some AREDS2 formula vitamins. Secondly, the wet macular degeneration can be treated with injections inside the eye. Very important if you have wet macular degeneration to see a retina specialist who specializes in these type of injections. It can mean the difference between seeing and not seeing.
So basically, if you've got some blood and some bad blood vessels in the retina behind the macula, is it behind the macula or what?
In the macula.
And so they make it where those blood vessels shrink down?
Yes.
Yeah. Darin, you've taken a huge volume of information and condensed it beautifully. We'll have to talk about diabetic retinopathy at another time. You have been such a great teacher. I love having you on the Dr. Bob Show. Please come back again.
Please invite me again. I'll be here.
Got to protect your eyes. Got to see your eye doctor. You got to have an eye exam on a regular basis. The doctor will tell you how frequent it should be, but age 40 or so, you need to start making decisions if it's every year or every 2 years. You've only got 2 eyes. Protect them. You're going to want to stay tuned because we're going to talk about standing up and feeling lightheaded. And I've got high blood pressure. Well, I don't need a sleep study. Maybe the most important thing you could do. You'll want to stay tuned. I want to thank Dr. Darin Smith. Wonderful discussion on how you and I can prevent visual problems later on in life. Thanks, Darin. And now for questions from you, the viewer, that I think will be important to your health. Dr. Bob, why do I get dizzy when I stand up? Well, 2 things come to mind. Number one, it's a very common thing. People stand up and they get dizzy. We got to know what the word dizzy means. Does it mean lightheaded or does it mean vertigo when the room spins? And we're talking about a lightheadedness when people suddenly stand up. Now that's very, very common as we get older because we've been lying down flat, and then when we stand up, the body has to adjust to change in position. There's a little area in the neck where the big carotid blood vessel comes in, called the carotid body, and it's responsible to keeping the blood pressure the same as our body positions change. So as we get older, if that carotid body gets hardening of the arteries, it doesn't adjust as good. Or if we get a common cold and the autonomic nervous system is not working as good in that area. So if you find you jump out of bed and you feel like you're going to faint, that's lightheaded, giddy, dizzy, be sure that you grab the bedside table, you adjust your position, you take 2 or 3 seconds, minutes, whatever it takes to adjust. And then you'll find that you'll go without falling down on your nose, without breaking a hip, without breaking an arm. Now, if we've got a common cold, the same thing happens, so you need to be careful when you suddenly stand up. It's the carotid body that's doing that, and that's something that can bother everybody. Lots of other causes for lightheadedness, for dizziness, for vertigo, but that's the one when we suddenly stand up. Question number 2. Dr. Bob, my doctor says I have high blood pressure, and he wants to get a sleep study. Is there a relationship between needing a sleep study and high blood pressure? If you have high blood pressure and you wake up in the morning with a dull frontal headache and you snore, you have sleep apnea. You may have sleep apnea anyway. Let's talk about sleep apnea. That's where we stop breathing for a period of 2 to 3 to 4 to 5 seconds or up to 30 seconds. When that happens, it puts stress on the body and the body says, wake up. The adrenal gland has to put hormones out that cause the blood pressure to go up to save our life. So we've got fright and flight when we suddenly stop breathing and our blood pressure goes up. And if that happens every night, then you have high blood pressure. Very commonly, people that have high blood pressure need a sleep study. So talk that over with your doctor. Understand why having problems with sleep cause stress, not only sleep apnea, but insomnia, not sleeping well, poor sleep habits, poor working a night shift, all of those cause problems. And so if you've got problems with sleeping, you may have problems with high blood pressure. So you and your doctor then can decide what medicines are correct. If you've got sleep apnea, you can correct that and the blood pressure can go away. Being overweight could even go away from obstructive sleep apnea. So it's something, nobody wants to go on a CPAP. Everybody's afraid of that. I couldn't handle the CPAP. May be the best thing that could happen to you. That's all the time that we have for this show. Hope you've enjoyed it as much as I have. Remember, exercise It's the one thing that probably we need the most of all and we're deficient in. Get your tennis shoes and get outside and walk. If you exercise, it will cut down stress. It will cut down on your blood pressure. It will make you feel better. It will help you lose that weight that we want to do. So exercise is so important for you in your life. 8 hours of sleep. If you're not sleeping well, it could cause stress, and that stress could cause high blood pressure. There are lots of things that make us not sleep well at nighttime. So we need to know how to sleep, and we know what could prevent us from sleeping well. What medicines are you taking? Are you drinking cola with caffeine or coffee at nighttime? Are you smoking? All those are stimulants to keep you awake. So if you're doing something that keeps you awake, you have to get it corrected. Pain can keep us awake. Having to go to the bathroom too many times can keep us awake. So know that a good night's sleep is important. You need to correct the problems. We need to eat properly. Wow. Fruits and vegetables, what they do? Well, they're good foods. They don't have fat in them. They have antioxidants in them. They're the best kind of foods that you've got, and they will make you healthier if you eat properly. And most of all in the Dr. Bob Show, what do we like? It's that laughter in your life. Remember to laugh a lot, find that person you love, giggle a lot, have a great time, and you will stay healthy.